thank you to Richard Caulfield, who's joined us today from the Association of Colleges. He's the Northwest Regional Director, and he's here to talk to us about staff development to do with mental health in FE colleges. So I'm going to hand straight over to Richard and say thank you very much.
Oh, hello everyone. Thank you
Richard,
for joining.
I can't really hear you at the moment.
Oh,
very quiet.
Hello everyone. Yeah, thanks for joining us today. I feel as though this is a sort of story that's coming close to a conclusion. This isn't about all the answers, but I think it's a direction of travel and some success, about some success stories I've had in recent months, and mainly due to meeting with lots of very inspiring people within the health system, within the DFE and within the colleges. And I want to take you a bit through that story, but just a quick bit about me. I'm the Northwest Regional Director for the Association of Colleges. I've been in post coming up 2 years in December, having had a background in the voluntary sector and also sitting as a member of a clinical commissioning group, so some engagement with health, but very much as a layperson. When I started this job 2 years ago, I went to see all of my 54 principals one-to-one, sat in rooms with them. I asked them the question, what keeps you awake at night? To which 2 in 2 days answered the mental health of my students. I then asked questions about mental health everywhere I went and got some startling feedback. The colleagues starting nationally, Liz Maudsley, leading on our SEND work, and then we've just picked up the baton and been really pushing the mental health agenda. And actually, it's now one of the top priorities for the Association of Colleges. And I think I'll come to this through the slides, the strands I identified. But very quickly, what we did was we just wanted some very we had anecdotes. We just wanted to back up some of our anecdotes with an understanding of what was going on. And this research now is over a year old, and we're going to refresh soon. But even then, people were saying 2/3 of our members said there had seen a significant increase in mental health problems. I suspect that is going to be higher when we redo our research, and that will be year-on-year increases for the last 3 years in most places. I think the second point on there about significant numbers who had undeclared mental health difficulties, I think that's part about working with the age group that our colleges are working with. We know that many mental health problems become apparent in, well, I think it's 14 to 25, but naturally, therefore, the further education cohort have a huge number of them. Many of our colleges have some counsellors or some support. I'll come back to them later because I think there's a real opportunity for, I met with Health Education England yesterday in the Northwest about seeing these staff as part of the wider health workforce. So when health strategies are developed and training and support is developed, that our staff in colleges should be able to access this that work from the NHS. So I think that's key in the future. Also, I think that fourth question about relationships with local services was very much about services as a provider, and one of the things I think is missing is a strategic relationship between colleges and the NHS, which would lead to better access both for students but also for staff in terms of support they can get from the NHS system. And there's a high number of colleges doing support, providing support for students, and thankfully more and more providing support for staff, really, because I think, we're all absolutely clear that it's very difficult for us to be developing resilient students and supporting students if we don't have a resilient staff base to do that from. So just very quickly about what I've been doing in the Northwest. I've been trying to sort of take I don't know, I suppose you might call it, if I was very kind to myself, call it disruptive innovation, in terms of just trying to get through any door I can where I might make a difference. So one of the things that we're dealing with is the the geographies of health is a real issue. So I had a very positive meeting yesterday in Cheshire with a mental health provider, the Cheshire and Wirral Partnership, a commissioner for Vale Royal and for Cheshire West. Now that commissioner is on a different footprint to the provider, which is on a different footprint to what our colleges usually operate on. And so whilst I'm trying to develop a piece of work there about staff training and new staff in colleges to support mental health, you're trying to fight against geographic boundaries which cause problems in the system. That's a broader issue for us to be looking at. We're looking at the children and young people's local transformation plans and where further education sits in that, and trying to make headway in getting the sector referenced in that, so that we can, again, access everything from staff development to funding to support workers in colleges. And through that work, trying to get local representation on boards. So trying to engage. One of the things I think from working with the health system I know is more doors open when you're part of the system and you're engaged in it. So if you get on a number of strategic boards, committees, you'll find that doors will open, and that will access resources or access to resources that will be able to support staff. And I've recently set up 4 sub-regional networks covering the Northwest for mental health leads in colleges, and to discuss strategic issues with them about their approach to mental health. So of all that work I did and I continue to do, I sort of identified 4 big areas, and obviously today we're going to very much focus on one, but resilience. I need to work on the resilience of students and staff development, and I brought that down to 3 groups there, and we'll come back to that, and to sharing good practice and strategic engagement. They all intertwine. I think the strategic engagement and sharing good practice will all link in with staff development in various ways and opportunities for staff development. But I think there's a starting point which is about all staff. And this isn't yet AOC policy, but I have a belief that I think all staff should have some initial training in recognising and understanding mental health. And everywhere I go, everybody points us back to the MindEd resource. And that seems to be an exceptional resource. And I'd like to see us using that and rolled out in some ways in the same way that prevent training had to be delivered across the board to everybody working in college. I'd like to see the same approach around mental health being taken. The chances of college staff coming across people with a mental health problem, sort of probably 100%, it's going to happen. And knowing what to do and how to support and where to signpost is going to be vital. I suspect the amount of people identifying terrorists is much lower. So I think the mental health stuff is absolutely vital. And actually, thinking about the government's prevent agenda, actually people who have mental illness, who suffer from major mental health problems, are going to be more at risk of being radicalised. So actually, if we can stem the flow of people with mental health problems, actually, I think we can say to government, we're supporting your prevent agenda. So I think we can play the game a little bit there with some of the language. But I would like to see the MindEd resource. We need to look a bit about how it's embedded in a college setting, because obviously every college will have a slightly different approach or support systems. So we're looking to develop it so that it is flexed for use in a college setting. I talked about a similar approach to prevent in terms of compulsion, is what I mean there, nothing sinister, I promise you. And also within that though, I think we need to, at the back of my mind, and I'm not very far on with the additional thinking about this, is the support mechanisms for staff. Some colleges in Greater Manchester I met last week are developing groups, networks of staff to sit down and be able to just provide support to one another because of the number of mental health issues they're picking up. These aren't specialist staff, these are your general teaching staff. but who are being impacted upon about the mental health issues that are being apparent within their student cohort. And I think that tells us something of the scale of this issue in colleges. A more focused staff development is the introduction of mental health first aid. And again, it's another thing that everybody keeps bringing me back to as being an absolutely ideal sort of course. And I think what we would first like to see is, I'd first like to see that every college have mental health first aiders in the same way, and that probably added on to their registered first aiders training, so that that is part of their cycle of training to be up to speed on mental health first aid. I would like to see us go beyond that, but I think in the first instance, there is a win to be had by saying that should be an addition there. Now, encouragingly, we're seeing increasing amounts of colleges taking that up. And going back to the importance of strategic engagement, since I've started this work, I can point at a number of people and colleges that have trained their staff in mental health first aid, and that has been provided free by either a local provider or funded by their clinical commissioning group. In some areas, such as Liverpool Clinical Commissioning Group fund an absolute fantastic set of staff development opportunities for all people working with young people in the Liverpool area. So my colleges in Liverpool can access it, even those that have high numbers of Liverpool students but aren't in Liverpool can access that, and that includes mental health first aid. That also includes suicide prevention training, specific training around self-harm, and a number of colleges are accessing that. I think people, particularly suicide prevention, is proving particularly popular, because I think the amount of suicide ideation among students is causing grave concern, and actually understanding, having a better way of dealing with it is something that colleges want. I'm going to talk to the regional coordinator for Samaritans about this as well, because they seem to be rolling out some very interesting training or looking at specific ideas, and trying to pick up, as I say, anything I can anywhere. And again, I mentioned CBT at the bottom there, because again, one of my colleges in Greater Manchester are putting all of their staff through basic CBT training. So that's quite an interesting approach and quite forward thinking, considering I think we've got at one end of the scale colleges that are reluctant to let staff go off and train on this. At the other end, we've got some colleges that are really insisting that training is embedded, and there is absolutely some fantastic practice out there. I know places like Rees Heath have been doing across the board training for staff, and as I say, this was, I think, Ashton Sixth Form where they were picking up that training across the board in Greater Manchester. And then I want to look at the specialist staff and how much of this specialism college is required. Children and Young People's Eye Act becoming increasingly popular. Is my printer noise impacting upon this? No. Okay. As part of implementing the 5-year forward view for mental health, there have been several things put out around Children and Young People's Eye Act. Now, one of the initial challenges is, I think, the first offer was free training, which I think was 15 days a year in the year, which is obviously a significant chunk to take out from a college. And I think even since agreeing to do this webinar, and now there is an initiative out for the funding of psychological wellbeing practitioners. It's about increasing the children and young people's mental health workforce that's been launched by the NHS. And I've managed again over the last week or two to have some local discussions where there are commissioners and providers who are interested in this. And I think actually this isn't going to be about having staff employed by colleges. I think this is about actually NHS staff working in colleges. This will be about providers working in colleges. So I think it may be better if we're going down this route for them to be based within a mental health provider rather than within the college as employment terms, although their activity will be in colleges, and then I think provide an excellent link between the college system and the health system, which is one of the problems I think we've got. Yeah, I mentioned that staff need support too, and I think there are some real opportunities for this, particularly around linking with the staff as being part of the NHS system. And my discussions with health education yesterday were about, can they provide some forms of supervision? In fact, going back over my whole presentation, can they start to provide some training opportunities for all staff in the mental health arena? So that could be that they're saying, actually, the whole mental health awareness, they were flagging up some other work around that they may be able to roll out, and trying to see education as a key partner, the key place on the basing things on the Thrive model, which seems to be sort of the flavour of the month in every discussion, is actually how much can we train staff up to be the front line, the first people that identify issues, get people to the right support in the right place. And the challenging discussion there for us, I think, is very much around how we do that as an integrated partnership, because colleges are a little bit concerned that everything I've just said is about putting the burden of dealing with mental health on colleges and taking it away from the health system, sort of doing somebody else's job. So they don't want to do that. They're saying we're not mental health specialists, we're education and skills provider specialists. But how do we deal with this in a way that says, let's find a way that we can help a student stay in college, succeed in college, go on to work or further study, and how do we ensure that our staff in that have the necessary basic skills, basic knowledge about being able to pass things on and signpost, and also the support to ensure that they don't go under and start to suffer stress as a result. So I think we need to be in what colleges need to do is, I think we need to be talking to the whole health system. And I think this is one of our challenges, how complex that health system is. It's crazy. In fact, I could have added strategic clinical networks on there, because I've just started talking to one of them, and I'm not sure if I asked the college if they have these relationships in a strategic way, how many of them would say yes. I think it would be pretty low. It's going to be part of our next research, is what these relationships are. But we need these relationships at every level. And it's amazing how many people are just unaware of further education colleges and sixth form colleges. I had to explain that to all the people at the meeting yesterday afternoon, and once you explain that, they're very excited about the potential, and they're keen to work with the staff, they're keen to work with students. Of course, one of the challenges, as ever, is how do you find the space, the time, the capacity for that in a sector that is thin on the ground with staffing at the moment and resources, and under the cost to deliver quality. But we need to see that providing these support services is part of delivering the quality. And if we can manage the mental health issues early, getting there early, then actually we'll see greater success amongst our students. And that actually is the end of my presentation, probably a bit shorter. Sorry, there's no specific direct answers to things. I don't know, I hope people weren't expecting me to give a direct answer to what the staff development should be, but I do think thinking in the very first instance about a core offer for all staff about mental health awareness and utilising MindEd and other resources out there. I think a specialist approach to ensuring every college has some people trained up in mental health first aid, and 2 or 3 of the other additional key training opportunities around self-harm, around suicide. I think there'll be a growing need around transgender issues, as well. I think those things need to be built in there. And then hopefully at the far end, whether they're college staff or NHS staff, something around Children and Young People's Eye Act. And then I think we can start to create a pathway and a package of support that provides support for students and staff, and hopefully starts to tackle the issues that are there.
Thank you, Richard. That's really interesting. Do you want to just stop sharing your screen, and then we can, that's it, then we can see people back in the room, and I can ask if anyone has any questions for Richard. I'm just going to scan the chat room while we're here as well. Any questions? If you have got a question, if you either want to raise your hand or turn your mic on or type into the chat pane. I had a few things that went through as I was listening. One of them was that you're up in the Northwest. Are any of your colleagues doing likewise?
There's a lot of work going on in the east of England at the moment, and the colleges in the east of England are going to be publishing a booklet of the work they've been doing soon. But I think you've had Stuart Rimmer do one of these webinars on their Action for Happiness work, so people could look at that. That's been a great piece of work. But the East are doing some. I'm going over to the Northeast in the first week in November to discuss the broader work I've been doing and see how we roll it out in the Northeast. And there's interest from all the regions to start to roll out something similar.
Stuart is actually doing his webinar next Friday, so he hasn't done his yet. He'll be next Friday, everyone. So, Anna's made a comment in the chat pane. She says, we need to be mindful about linking the prevent agenda with mental health. Prevent policies ideology, which is normative for most Muslims. People within the outside Muslim communities are thinking it does actually breach civil rights. Unless someone is knowledgeable about this, I wouldn't make the link. Also,
I'm sorry. I suppose, you're right, and I accept that. I think that I was trying to word it carefully. The two things, I suppose one thing that I keep doing is using that comment as in, they insisted that we should all be trained about the prevent agenda. Well, actually the mental health agenda to me is more important in this regard, and we should be doing that. And number two is the link around, it's difficult. It's the language I might use to try and twist the arms of civil servants towards releasing the resources for this, I guess. In playing that language, I wouldn't be stood upon a platform portraying that, but I've done it today, I guess. So I know what you're saying, and I'm trying to find the right language and way around that discussion. But I do think there is a wider issue and problem of creating vulnerable people per se, if we allow the mental health crisis to continue.
Thank you. Any other questions? You're very quiet, and I'm going to carry on with mine then. You've mentioned a number of the colleges in your area that are doing really good stuff, really interesting things around around mental health and staff development. Have you produced any case studies as yet, or is it too early?
It's just a bit too early. I think we're on the. I think there are some out there that we know we want to go around and capture. I know where a lot of the case studies are in our conferences. We've brought along people to tell their stories of good practice that's going on anyway. One of the realities is that this agenda is just a sort of part of my work, rather in fact it's sort of more an interest that I've taken and trying to drive through. So we're just trying to access some resources so we can spend a bit more time, capture that information, and start to share it through a range of channels. So what's the best way to disseminate it? So that's part of our agenda. I could just do with a bit more resource to be able to do that. At the moment, it's I'm going around causing trouble. I've just emailed, I've been on to a CCG today with 2 principals saying, you've got this big plan for transforming mental health services for young people. It's got a list of education institutions. It doesn't even mention the colleges, even in your list. So we are, we're fighting an uphill battle in some areas just to be seen and get into the agenda. So I'm spending my time doing that at the moment.
Thank you. You also mentioned in there that you've set up some networking across your region, so you've joined organisations together. Is there scope for our projects that are happening in the North West to tap into those kind of...
Sorry, say that again.
Okay. You're reading the chat.
Yeah. Got that for a second.
I just said that during your presentation, you said that you'd set up some subgroups within your region, where you're getting your colleges to work together and share, I suppose, share practice and things.
Yeah.
And I was wondering if there was scope for the community learning providers and the projects that are running up in the Northwest, of whether there's scope for them to kind of tap into those networks as well and share across, community learning and colleges.
That might well be a worthwhile thing to do. I'll pick that up with Katina as a potential to work across there. I guess, there's always an issue when we do anything that's done from our own membership fee about who's there. We've got to be honest about that. But the mental health agenda does really lend itself to much more sharing. We're not competing on this one. We want to have the best practice in all places. So, if we can share that might well be worth doing. One of the challenges is that, of course, the people I get to the networks are not always the people that then can make strategic decisions as well. So we come up with great ideas, but then they've all got to go back and sell it to their principals as something that either needs some money spending on or some time given to what have you. So there's a lot of hearts and minds around this, aren't there? And I guess, again, that's part of my strategy is, finding the people. And I know you've got a big network of people who are already doing this, and that's why some of this is key, but finding all them different people and bringing them together as much as possible to get activity going.
Okay, that's good. Katina's just responded. I don't know if you've got that far down in the chat. Yeah. She likes the word sharing. Katina's also put some extra information in the chat pane for everybody regarding the Prevent agenda and some information that's already up on the Equalities Toolkit. You did mention that you think that mental health is going to be there's going to be more and more of a need as things like the different protected characteristics, transgender, etc. You mentioned briefly there. Do you want to expand a little bit on that?
I suppose in some respects what I would say, I think there are, I do think we are getting somewhere with people being able to voice some of their concerns. I do think there is some of the increase we are seeing, which is based on people feeling they can speak out a bit more and seek support. And I think that's really positive. And there are some communities where mental health will be and is a bigger issue than others. And so I have been aware that, in the transgender population, mental health issues seem to be more prominent. And we do seem to have a growing number of young people transitioning in that college age group or considering transitioning, and they need that support, and we need to get that in the right time and place. And colleges are saying that it's been brought more to the fore now than ever before. Now, we're not talking huge numbers, but we are talking about a huge need and something we need to get right and make sure that we support people in the right way. So I think there's more and more specialism required in there. And I think to some extent, again, a more personal point of view, I do think perhaps some of the equalities agenda seems to have been sort of put more on a legal footing in recent years, as long as you're doing the right legal things as opposed to doing the right thing, in my view, has been sort of been the direction of travel for many. So I just think we need to be aware of where we might need to look at new developments and new. But I guess 20 years ago, we might have been saying self-harm, not as big an issue, whereas now self-harm, it is just massive in colleges. So there are things that come through all the time, and staff need to be prepared for, whether that's about the type of ways that mental health is being expressed or coming through, or whether that be equality strands where we need to be aware of need and of that being sensitive and appropriate for the people that need the access to services.
Thank you, Richard.
Yeah. I'm really worried that I didn't make myself, that I've made myself misunderstood around the prevent agenda. Because, but I'll need to come back to some of that at some point.
To me, I thought you were referring to the fact that you would like to see mental health rolled out.
That's what I'm trying to say is they've done that.
Yeah.
You can do that with mental health then, and
in a similar way as you would say for equality and diversity.
Yeah.
It should be standard as opposed to leaving it to the staff, I think, is what I got from it. But I can see where the
I can understand
where Anna is coming from as well, and it's good that she made that point. So thank you, Anna. Any questions? Any more questions for Richard?
If people have any idea.
Yeah, hello.
Yep.
Richard, you spoke about the whole staff approach. What does that look like? When you say, are you talking about with tutors, departments? What does that look like, and how do you embed that?
Well, I think what we need most certainly is colleges to start to have a whole college strategy and approach for mental health. So that would set out how you would support staff, how would you support students, and then what training should be done in the workplace, and what's the training staff. And I would say, I think what I was trying to say is that I would say all staff as a minimum should have done the very basic Minded introduction to mental health, along with what does that mean in our college? Because every college will be slightly different, won't they? You will have different referral systems, maybe slightly different ways that your safeguarding operates where they are. So that everybody, whether they be a cleaner through to the principal, will have done that basic. And then your next tier then will depend upon your strategy, I think. The more training, the more input, the better. But, I'm not going to go to war with principals on trying to get staff training for everybody on everything. So they'll tell me how many days a year they've got to do staff development, and that they will be hung, drawn and quartered about their English and maths outcomes. They'll be hung, drawn and quartered about other things. So it's, there's the desirable and there's the what we can realistically achieve across the board. But then if you watch Stuart next week, I think that whole college approach to happiness that they're taking, where you embed an approach amongst your staff and students, is a real way forward as well. So I don't think there's one simple way, but I think it's about understanding, because colleges have different contexts as well, and they need to be sensitive to place. I suspect that doing this work in inner city London will be different to what it looks like in Lakes College in Cumbria. That everybody needs to, but equally there is a need. We know there is a need there. So I'd like, sensitive local strategies, really. Okay, thank you.
Okay, thank you very much, Richard. I think that is all. That is everybody. Everybody had their questions. I can see some nods. Yeah. Well, I'm sure if we do have any follow-up questions, or when you've got case study material or things that you could share, that would be really, really interesting to see. So thank you.
Great, thank you everybody, and thank you for your time. Oh.